right, Dr. Singleton, thanks for being here with us today.
Thanks for having me.
So maybe before we get started, if you want to describe your background a little bit, tell us what you do, how you're related with Lehigh City, and kind of what your expertise is, I guess.
Yeah, so I'm an emergency medicine physician. So if you ever go to the emergency room, you know, with a broken bone, gunshot wound, bad stomach flu, it might be me you see.
Okay.
I've been doing that for about 10 years to work in local hospitals. I also oversee or help train paramedics and other type of personnel for Lehigh City through the Lehigh Fire Department.
Okay.
And so I try to keep them up to date on the state of the art medicine, and they keep me up to date on everything that's emergency medicine personnel, and help us save lives in the community. And I also work as liaison in my hospital, doing outreach for our fire stations throughout the valleys.
Okay, awesome. So you have helped us out a little bit through this whole process of the coronavirus since the last spring until now. I know we've asked you a lot of questions, but we decided to reach out to our employees and find out what concerns they might have about the vaccine and questions that they might have about the virus, and wanted to maybe go through some of that with you.
Yeah.
So first, there's a lot of question about natural immunity that comes from contracting the virus and the antibodies that you build up through that process versus having a vaccine. So can you maybe explain the difference between those, the two of those, your natural immunity that might come from that, and then the immunity that you would get from the vaccine?
Yeah. So both types of processes do provide immunity. However, vaccine immunity tends to be better. And the reason why is they stimulate the immune system more. And so we have research now that shows people who've been vaccinated have about 3 times more antibodies in their blood than people who haven't been vaccinated but have had those natural infections. And not only that, those antibodies last longer because we're doing 2 shots instead of, for most of these vaccines, instead of 1. And so it's almost like you're getting the virus 2, you're getting a booster. And so you're probably, I think it's fair to say, you're 3 times less likely to catch the virus again if you've been vaccinated.
Okay. All right. So that answers our question. There was a question about whether or not you would still need to get the vaccine if you have had the virus. And the answer probably would be yes, because of the additional antibodies that you get from the vaccine.
Yeah, so if you actually had the virus and then you get vaccinated, you have what's we call double protection. And so I find those people are the ones who are very unlikely to get the virus again. And it's a pretty amazing defense that you can set yourself up with. Another reason to be vaccinated if you've had the virus is a lot of people have lingering symptoms from the virus, whether it's fatigue, lingering shortness of breath. Some people have lingering loss of taste and smell, and the vaccine is actually shown to help with some of those long COVID symptoms. We don't quite understand why. The thought is there might be small amounts of virus still hiding in our bodies, escaping our immune system, and the vaccine just alerts our immune system to eliminate any lingering virus. And so not only do you get longer immunity, you can also improve some of those long-term effects from the illness.
So how is the virus different from something like chickenpox, where a lot of us had chickenpox when we were younger and don't need to be vaccinated for chickenpox now because we had that virus, and so it's kind of a one-time thing, whereas coronavirus seems to be different, where we get the virus but then it's still recommended that we're vaccinated.
Well, it's important to know that people get breakthrough infections of chickenpox. It's called shingles, and we actually do a booster shot as patients get older to prevent that chickenpox from coming back. So it's not usually a one and done, and oftentimes when chickenpox comes back, the second form as shingles, it's much worse than the original infection. And so just know there are booster shots we do for chickenpox.
Mhm.
The other thing that's important to know about chickenpox is it doesn't mutate quite as fast as coronavirus. The coronavirus is an RNA virus, where the chickenpox actually involve your DNA to a certain extent. So it's more stable, mutates less, and so it's not changing as rapidly. Coronavirus will hopefully quit mutating so quickly once we have most of the world has immunity to it. But right now, as long as it continues to like blow through our population, it's going to mutate a little bit faster.
Okay. So now talk us through the process of developing the vaccine and the FDA approval for that. And then maybe, I know there's three different brands per se of vaccine. Is there one that's better than the other, or are they all equally effective?
So it's important to know that there were no shortcuts made with this vaccine. So normally a vaccine takes longer to approve because there aren't enough people being exposed to the pathogen. What was unique about coronavirus is we had hundreds of thousands of infections per day. So in the trials, it became clear quickly if the vaccine was effective or not. And
Okay.
so that's what led us to be able to prove it quicker, is we just got an answer quicker, because coronavirus, essentially all these populations that we're studying, we got an answer quickly.
Okay.
The other important thing to know is at this point, almost 1 billion doses have been given out. And so we are very familiar with the side effects from this vaccine. No intervention in medicine is 100% without side effects, but we are finding this vaccine is as safe as any vaccine that's been made.
Okay.
And I expect it'll have full FDA approval in the coming months. FDA wants to show that they're being extremely cautious with this, but I'd be surprised if it doesn't have full FDA approval by September, October.
Okay.
What was the latter part of the question?
The Pfizer, Moderna, Johnson
Yeah.
Johnson.
So all the vaccines are effective against preventing hospitalization and death. Fairly similar. I find we feel like the data is showing that the Pfizer and Moderna might have better long-lasting immunity and might have a little better protection against the Delta variant. But we're still learning about that. We're also finding that the Pfizer and Moderna have maybe a few are less likely to have some of these really rare side effects. And so if you, some people like the Johnson & Johnson because it's just one shot. And so if you hate the idea of getting 2 shots, I would go with the Johnson & Johnson. But I think it's probably our best vaccines are either going to be the Pfizer or Moderna.
Okay. So let's talk about some of those side effects and maybe some of the risks. Something I hear often is a concern about pregnancy, your ability to get pregnant, the effect on fertility, even going through in vitro fertilization, and the vaccine. Is there any shown impact on fertility from getting the vaccine?
Yeah, so the good news at this point, we have a lot of data on women who've gotten the vaccine, women who've gotten pregnant, and subsequently got vaccinated. Thus far, there's no evidence whatsoever that it could in any way affect fertility. In fact, the people that started the rumors and the mechanism they described, it just doesn't make sense from a biochemistry standpoint. It just simply does not cause infertility. And recently, all the major medical organizations, including the biggest OB/GYN recommendation, is recommending every woman who's pregnant who hasn't been vaccinated get vaccinated right away. And the reason being is we do know that the virus itself can cause miscarriage, preterm delivery, and there's even a possibility that it can cause birth defects. And so to avoid all those complications from the virus, it would be very helpful to have extra immunity. And so if I would say any woman who's thinking about getting pregnant soon or who is pregnant, or who's a nursing mother and wants to her breast milk to provide protective antibodies to her infant who might be more vulnerable. I say get the vaccine today. If there's anything I can do to push you, get the vaccine today. We have data now that says this is safe and effective for future mothers, current mothers.
Okay, great. So what about the impact or the long-term risks of the vaccine compared to the long-term risks of the virus?
So it's important to know that it's almost unheard of to have a vaccine's side effect that doesn't present itself within 6 weeks. And so I feel confident that we have the data to say we know what the long-term risks are. This vaccine's been out for 8 months now, and we've given over 1 billion doses. We know what the long-term risks are. And the long-term risks are similar to any vaccine. There's these 1 in a million chances that you could have serious allergic reaction to the vaccine, just like you can with antibiotic. Essentially, with anything you put in your body, there's always that, peanuts or nuts. Anything you put in your body, there's always that 1 in a million chance. The good news is that we can combat those allergic reactions. All our city paramedics are trained to do this. All our hospital personnel are trained to do this, and there's simple antidotes. I haven't seen, I don't think I've seen a single true anaphylactic reaction just because they're so rare. I do see a lot of people have panic attacks after getting the vaccine. It can be nervous with they can become nervous with all the misinformation coming out.
Yeah. Okay.
There's a few rare disorders with clotting, again, that they occur about 1 in a million, and we see that with all the other vaccines. It's extremely rare. Now, the side effects with the virus itself, with adults, 1 in 3 people still have symptoms after 3 to 4 weeks later. In fact, I see, as much as I see patients who have coronavirus symptoms, I also see them several weeks later dealing with these after effects. And those are shortness of breath, chest pain, blood clots to their lungs, headaches, extreme fatigue. We even sometimes see it affect their heart, and cause heart failure. And as I mentioned, with pregnant women, it can cause miscarriage. And it is, if you could just see how sick these patients look initially and how bad they sometimes look several weeks later, you would want to shout on the rooftops just to tell everyone to get vaccinated. It's just simply not worth the risks of this virus. I realize many people have mild symptoms, but there are enough who don't, that the risk is too high not to get vaccinated.
Yeah, and so how long do we think that some of those side effects will continue to have an effect? You mentioned earlier taste and smell are gone for a lot of people, even months after having that. Do we know how long those types of things will be in?
Yeah, so the good news is most depends on how sick you were. So the people who had mild infections who lose their taste and smell, most are getting it back in a couple weeks. Very few don't have it back within a year, but sometimes it drags on 6 to 8 months. There are things, if it's dragging on weeks to months, you can do therapy to retrain your smell, and that can actually help speed up the recovery process for taste and smell. Some of the fatigue and that other things, it varies. Some people take months. There's still people who got infected early on who still aren't 100%, even a year later. And so we're still learning about how long this long COVID lasts. The good news is most people get better, but the really sick ones, it's possible they may have some of these side effects, some of these long-term symptoms for the rest of their lives.
Okay. So in your experience, what are we seeing as far as the percentage of people coming in that end up being hospitalized that have previously been vaccinated and then contract the virus?
So we have data right now that shows that, and it varies a little bit from state to state, but it's anywhere between 1 to 2% of the people hospitalized have been fully vaccinated. And then the people who've died from the virus, it's less than 1%. And so it's extremely rare to get super sick if you're vaccinated. We see it more in patients who are older with weaker immune systems. Their immune system, even though they may have been vaccinated, just isn't as robust of a first-line defense. And so we need to take extra caution with patients who are older. If there's any way I can convince people who work in nursing homes to get vaccinated, because they could easily kill one of these patients by not being vaccinated.
Yeah. So is that also the case with the Delta variant? We know that it spreads faster, is more contagious. Are you seeing that still the case with some of these other people that have been vaccinated, specifically with Johnson & Johnson? You mentioned it's probably more likely that they could get the Delta variant compared to others.
Yeah, so in the initial trials of the Johnson & Johnson, there were no deaths of anyone who was vaccinated and caught COVID, and there were maybe 1 to 2 hospitalizations, if any. So Johnson & Johnson is still very good at preventing the most severe symptoms. The Delta variant is much more contagious, and so you could be exposed to 5 levels higher amounts of virus with someone who's sick with COVID with the Delta variant than you would have with the original virus. And so it's possible we'll see more breakthrough infections, but still we're not seeing a big increase in breakthrough hospitalizations. So I would still say the vaccines are doing a good job at keeping people out of the hospital.
Okay.
So, and we'll learn more about that to come. But right now, the best way to stay, having a major effect from coronavirus is to get vaccinated.
So what about those people that maybe have a medical reason for that they cannot be vaccinated? Do you see that often? And if so, what kind of response should they be taking?
Yeah, so there are a few medical reasons. I find a lot of the medical reasons they probably still could be vaccinated. It might be worth talking to more than one expert on vaccinations and see what they think. But I would say that if you can't be vaccinated and you're high risk, I would do everything you can to have your inner circle, the people who live with you and work with you, to convince them to be vaccinated. And if you're going to be around people who may not be vaccinated, I'd wear a mask and try to convince them to wear a mask as well.
Okay.
And as we gain more immunity, eventually the risk of being exposed to the virus is going to go down. But I would definitely be sure that you cannot be vaccinated before you make that decision. Talk to a few people. And we're even finding people who've had severe allergic reactions to the first dose. A lot of them do fine with the second dose. And so just because you've had a reaction to a vaccine before, even that may not be a contraindication. Just make sure you talk to someone beforehand, and they can take necessary precautions to watch you closely.
Okay. Great. So let's talk about, you mentioned wearing masks. We're hearing now that the recommendation is that if you've been vaccinated and you're in groups and you're unable to social distance, that CDC is recommending that you still wear a mask. We both have been vaccinated, so we are not wearing masks right now. We've both been vaccinated. When do you know when to wear a mask and when not to wear a mask, inside, outside? What are your recommendations on that?
So I think if you're outside and you're not super close to other people, it's always okay not to wear a mask. But if someone's within a couple feet of you, especially if you're going to be in a crowd where they're packed together for a certain amount of time, then it might be worthwhile to wear a mask. But if you got space, your exposure to the virus is likely to be very low. Now, right now in the US, about 60% of all adults have been vaccinated. And so that means at any given time, there's a 40% chance that you could be exposed to someone who's unvaccinated. And so the smaller the room you're in, and the more people that are in the room, the higher risk you're going to be exposed to the virus. And so I would say, especially at work, if a bunch of you are huddled in a small office and a bunch of your coworkers haven't been vaccinated, I think it'd be wise to have people wear masks when they're in the same room, just because you could have pretty significant exposure to the virus. My experience is the breakthrough infection we're seeing are people who've been at a super spreading event. You know, that would either be like a bunch of people in a small room not wearing masks, or you know, like at a concert where everyone's just packed together. Or they'll have a family member who, you know, they're living with, and they're with 12 hours a day in a small room. These are where a lot of our breakthrough infections are occurring, with these really close contacts. And so it's important to know that the vaccine does provide lots of protection. It's think of it as like a wall, but that wall can still be overwhelmed if you have too many attackers at once. And so no virus is ever 100%. And so potentially the more you're exposed to the virus, the more at risk you are to getting a breakthrough infection.
Okay, interesting. So, and that kind of leads us into the next question. We hear often that, you know, we've been vaccinated, but we could still spread that to other people. And you talked earlier about the risk of the side effects of getting the virus, and the symptoms of that are probably a lot less impactful if you've been vaccinated. But why is it still possible for us to spread that virus when we've been vaccinated?
Yeah, so this new variant is probably 5 times more contagious than the original. And so it's more contagious even than what smallpox was. And so next to measles, there's probably no virus more contagious right now. And so what that means is that we're getting exposed to higher amounts of virus. And so it's our antibody defenses have more likelihood of being overwhelmed. And so just know no vaccine's 100%. When we have measles outbreaks, there's always a few people who've been vaccinated against measles who still get measles. And we have other types of outbreaks. It still happens in people who are vaccinated. As I mentioned, chickenpox, which is fairly similar in contagiousness to this new variant of coronavirus, it has breakthrough cases as well. And so some breakthrough cases are to be expected. The good news is that thus far the vaccine is preventing very few serious effects. But I will say that you can still get, you know, fairly sick even if you've been vaccinated. And so I would take pause before you go to a super spreading event, especially if you have people in your inner circle who might be immunosuppressed. I would just hate for you to know that you were the one that spread it to them, and they got really sick from it.
Yeah. Okay, so what kind of information are we getting now about the potential for a booster? As we move forward, as it continues to mutate and spread, do you think that that's going to be something that's going to be in the future, where we'll potentially get a vaccination every year?
Yeah, so it just came out in the press yesterday that there is going to be a booster dose. It's going to be for those who are immunosuppressed. It's not clear yet. It might be soon after we wrap this up that there'll be more clarity, but it's not sure which immunosuppressed groups will be included. I know it'll definitely be people who have transplants who are immunosuppressed to prevent their body from rejecting their transplants, but it may include all groups who might be immunosuppressed. And so that's going to be coming that way in the coming weeks. Now, for people who aren't immunosuppressed, they're prepared to give a booster, but they're watching how quickly the antibodies fade and how many of these breakthrough infections we're seeing with the Delta variant. So that's more of stay tuned.
Okay.
But I would be surprised if in the winter there might be a third booster dose for everyone, but we just don't know that yet. But it's definitely coming for certain groups who are immunosuppressed.
And if you've received one kind of vaccine, so if you, for example, if you've had the one-shot Johnson & Johnson, can you, when that booster comes out, go with a Pfizer or Moderna vaccine, or does it need to be the same?
Yeah, so right now the boosters are going to be for the Moderna and for the Pfizer. And so I don't know for sure what they're going to say for the Johnson & Johnson. If Johnson & Johnson, they might be looking into doing their own booster, or maybe we'll just recommend that you get a Moderna or a Pfizer as a booster. So that's still an unknown area as far as what their booster will be.
Okay, great. Any other information that you feel like we might want to consider as we're looking into this?
Yeah, so I see on this list here, it's important to know that there are some people who do have legitimate reasons not to be vaccinated because of their health. For instance, I have a friend who has a rare type of leukemia, and she just can't be vaccinated. And she's faced a lot of scorn from her family and close friends and the community at large. And this is a person who does really well at isolating from others and wears a mask. It's very unlikely that she's going to spread the virus to others. So just know we don't know what the reason why people aren't being vaccinated. I find that shaming and being hurtful is less effective than love and kindness. And if you come at it from a place of love, even if they don't have a legitimate reason not to be vaccinated, you're more likely to be successful. So we like to say love conquers all. Just be compassionate and loving in the way you persuade others to be vaccinated, and just say, look, I love you. I don't want anything bad to happen to you. Please get vaccinated. We have enough data that shows it's safe and effective. And I truly believe that there would be almost no vaccine hesitancy if there wasn't so much misinformation. This is the first, medical crisis we've had where we essentially have social media that's a free-for-all for misinformation. And so, although it's predictable it would happen, unfortunately so much misinformation is spread. A lot of people have felt confused, and so we just need to keep persuading people and just know that the data is clear, this vaccine is safe and effective for the spread of coronavirus. And if you want to prevent your family and your friends from getting sick from it, get vaccinated today. Don't delay. This new virus is so contagious, this new variant. It's not a question of if, but when you're going to be exposed to the virus.
Well, that's a good point. So how does somebody know if the information that they're reading is factual or is correct? What kind of recommendations do you have for that?
So just know there's always going to be fringe beliefs. So you might find a doctor that says, that's going against the grain. Just be very wary of anything that's fringe belief, because every profession has people who don't follow evidence-based medicine. And so first I'd say it needs to be from a respected news organization, an organization where if their reporters get caught sharing something that's not factual, they'll get fired, because you have news organizations that essentially can say whatever they want to without any consequence. So it's got to be a respected news organization, one that's been around for, I would say, decades, and one that have kind of those consequences. Two, it should follow the governing body's recommendations. So what's the American Medical Association saying? What's the American Academy of Pediatrics saying? What is the CDC saying? These are groups that look at the whole body of research. It's very easy to cherry pick research to support any position you want, but you have to look at the whole body of research to support your stances. And right now, the whole body of research is saying that these vaccines are safe and effective. And not only that, but masks prevent the spread of coronavirus.
Okay. Great. Well, thank you so much for your time today. I know you're a busy person.
Yeah, thanks for having me.
Yeah, and just a thank you to you and the other doctors and nurses that are out there fighting this every day. I know it's a very taxing process, and the hospitals are being overwhelmed at this point. And we just really appreciate all the effort that's going into making sure that we stay safe.
Yeah, appreciate you having me, and I just can't say how heartbreaking it is to see patients sick. I worked a shift last night, and all my new sick patients weren't vaccinated, and their symptoms were horrible, and you hate to see this, especially knowing now that it's preventable with these vaccines, and you just don't know how it's going to affect you. And if you're listening to this, get vaccinated now, because you don't know how sick you might get, but you also don't know how sick someone you might spread it might get. Right now, this new variant is so contagious, it's estimated you'll spread it to anywhere between 5 to 8 people who aren't vaccinated. And so just think of 5 to 8 people in your life that you could be responsible spreading to the virus to. And it can be heartbreaking if they get really sick. I have a neighbor that right now is really sick with it, and it just, when it's someone who's close to you, it just cuts you so deep. So if you're hearing this and you haven't been vaccinated, please just listen to our pleas. Get vaccinated today. We just want so much for you not to have to suffer the worst effects of this virus.
Well, thank you, and that's a good reminder for all of us. So we appreciate your time.